sant yàlla.
looy xaar utal Wave nga scan nga fay te nag doo ci yokku dara.
If the world hasn't stopped moving, your money shouldn't slow you down. With Bloombank Africa, you are always connected, wherever, whenever, in many ways than one. So whether you're sending funds to family, paying for goods and services, settling bills, or just making sure you've got some cash at hand, Bloombank puts speed, simplicity, and security in the palm of your hand. Transfer funds between your Wave or AfriMoney account and your Bloombank account anytime, anywhere, because your money should flow at the pace of your life. Visit your nearest Bloombank branch today to link your account. Bloombank Africa. We make it happen.
Jar Oil Company stands tall as a trusted name in energy, keeping the Gambia moving with service stations across the country and a commitment to innovation and reliability. In Farafenni, Jar Group is reshaping our industrial landscape. The Jar Oil Cement Factory can produce up to 100,000 bags a day, reducing imports, creating jobs, and building a stronger Gambia brick by brick. And in the heart of the Central River region, Jar Farming Initiative is cultivating food security. With thousands of hectares under development and modern irrigation, Jar Farming is turning the Gambia's soil into abundance. Jar Group is more than a company. It is a vision of self-sufficiency, resilience, and progress. The Jar Group of companies, investing in industry, agriculture, and energy, building the Gambia's future today. We're grateful to our sponsors. Now, in 9 days' time, we have a big global event happening, and the Gambia is part of the international community. And so we are going to spend the next 30 minutes talking about this event. And I have two gentlemen and a lady with me in the studio. And since they say ladies first, I'll start with the lady to introduce herself to us.
Thank you, Peter, and good morning, listeners. I'm Olimatu Koli, a senior program officer working with the National Malaria Control Program.
Fantastic. And after the lady, the first gentleman.
Yeah, thank you, Uncle Peter. I am Saja Jajusi. I am working with PATH, that is Program for Appropriate Technology in Health, as Data Manager and Statistic Associate, working closely with the Minister of Health, NMCP, to help in malaria elimination. Thank you.
And health has so many different partners. I'm hearing about PATH for the very first time. Last but not least.
Good morning, Uncle Peter, and good morning, listeners. I am Usman F. Bojang, National Malaria Control Program. I work in the area of monitoring and evaluation.
Okay. Let's start with, what the National Malaria Control Program does. Uli.
Currently, we are coming to commemorate our World Malaria Day, which is commemorated annually on the 25th of April every year, and it's commemorated to the day is commemorated to reflect on global efforts towards malaria prevention and control, and it's also a day that serves as an advocacy for government and global partners to renew their commitment to malaria prevention and control. And also, it's a day when we highlight continued commitment to sustain investment, political commitment, mobilizing resources, empowering communities, as well as strengthening partnership. So basically, these are some of the reasons why we commemorate World Malaria Day annually. Is to renew commitment, especially government commitment, bilaterals and multilaterals, international partners, to commit and reflect on gains already, the gains we have on malaria prevention and control, looking at what are the gaps, how best can we work towards eliminating malaria, and making sure that we bring everybody on board in malaria prevention. And the theme for this year, World Malaria Day, is driven to end malaria. Now we can and now we must.
Okay.
Yes,
okay.
This is the
in the Gambia, how significant is the theme, and what is the malaria control program doing about the theme?
Yeah. So good morning once again. You asked what we do at National Malaria Control Program. So the National Malaria Control Program is the body tasked with the responsibility of coordinating and fighting all malaria control interventions in the country. And our operation is guided by a strategic plan. And the vision, our goal, or the vision or the goal, the vision is to have a malaria-free Gambia. And our goal is to have zero local transmission for malaria by the year 2030. So this theme actually fits, with our purpose. So if you look at the past 10 years or so, malaria used to be a very, significant, public health challenge in the country, with high, incidence and mortality. But recently it has dropped very significantly to a point, we are thinking of eliminating malaria. And we have started this elimination effort in the country back in 2023. We want to start it by phase. We started with the North Banks, that is from Bara to Palodi, the two North Banks. By health region, we have two North Banks, North Bank East and North Bank West. Yeah. So we started the elimination effort there. So this team, this year...
What does that involve, the elimination effort? What do you do?
So what we normally do, previously what we used to have, like at the end of each month, the health facilities will submit their data. They will tell us this is the number of malaria cases that we have. And, they go to the facility, diagnose and treat it. So they come from compounds. That individual maybe, because he's suffering from the signs and symptoms of the disease, he decides to come to the health facility and get the treatment. But back home, there could be lots more of people there who have disease or who have this parasite in them, but they didn't report. So basically what we do with the malaria case-based surveillance is anytime there is a case that is reported at the facility level, the case is treated, and then we have a team of our surveillance officers, these nurses and laboratory personnel and pharmacists, that will go in that community to the compound where this individual is living and give, anti-malarial treatment, just to clear the parasite, in that particular area, so that nobody will have the chance of transmitting malaria to the next person. So we use this medicine called dihydroartemisinin piperaquine.
Is there a local name for it?
So you can call it DP.
Okay.
You can call it DP.
Let's work with DP.
Yes. So you give like all the eligible individuals in that compound. So in the neighboring compounds, like within 150-meter radius, we don't give them medication, but we talk to them to be using malaria control intervention like bed nets and observe environmental sanitation, and also to be using other services, like if there is a pregnant woman, that pregnant woman can be visiting the normal RCH services so that they can be receiving preventive treatment for malaria. We call it IPT. So they give them Fansida on monthly basis, starting at the 4 months, at the gestational age 4 months. So normally, and this is what we advise them. So we also ask them in the compound, the number of sleeping spaces that they have. and the sleeping spaces that have bed nets. So those without, we try and augment, and those with, we encourage them to be using these bed nets, to protect themselves from malaria. Mm-hmm. Yeah. So since we started, we have seen, a very, significant, reduction in the number of malaria cases in these two regions.
Okay. You try to link this year's theme to those efforts. So how will the theme, motivate you to do more of those efforts?
Yes. So this year, as Olimadu said earlier, we, compared to last year, we have a very significant reduction. So now we started with the North Banks in 2023, and now we are thinking of moving to other regions and districts that have, very low transmission, so that within a short time we can, cover these people with this case-based surveillance with the view of eliminating malaria in these two regions. So we have a cutoff point. Like they have to meet a certain criteria before we roll out this. Their incidents have to be less than 10 cases per 1,000 population. And currently, CRR as a region meet this criteria. So we are working with our partners.
So CRR has met the criterion. What about, the other regions?
Yes, the other regions, they've tried. Like, if you look at it, if you drill it down to district level, there are many districts. Like, we have 42 districts. So 15 out of the 42 districts, meet the criteria. But also, we also want to be cautious as when we are introducing this.
Okay. What about KMC, which is where I live, and I know that I have to be swatting at mosquitoes practically every night.
Yes, KMC just recently they did very well, but their incidence is not as low as the other areas.
You need to concentrate on KMC.
We are is the district that where the population is very high is has a combination of, let me say, majority urban population, and most of the time, like our experience with the past bed net distribution, the utilization of this intervention like bed nets is normally
very low,
and our past.
Is that because people feel westernized, and then in the West they don't use bed nets and whatever?
That could play a part. So
listen, it should be health first.
Yes, health first.
To enjoy your riches and whatever, you have to be healthy first and foremost.
Exactly.
All right, let's bring on Path. First of all, tell us about Path and how you partner with the National Malaria Control Program.
Thank you, Uncle Peter. Path means Program for Appropriate Technology in Health. And it is a non-profitable organization which is based in the U.S., supporting malaria elimination and other health interventions. It has a mission that to provide equitable health innovative solutions through partnership by scaling up evidence-based. So in Gambia, we are into different components of health, supporting vaccinations. But in Gambia, we are supporting the malaria elimination. That is working with NMCP. And the case-based surveillance that Mr. Bojang talked about in the two North Bank regions, that is the North Bank East and the North Bank West, SAO and Farafenni End. So the case-based surveillance started in September 2023, where every case is followed in the community, and they have developed protocols for this case-based surveillance. And the protocol is 137, that within 24 hours, if a case, a malaria is tested positive, should be notified within 24 hours. And it also need to be investigated within 3 days and respond within 7 days. So that is the 137 protocol. And this is really demanding. Some of the steps he mentioned it, that you follow the case to the community, sensitize the community, try to give prophylaxis, and also give interventions. If bed net is available, you help educate people if they see signs and symptoms in the community or within the compound. They can report to the nearest health center to do their testing. So when PAD came in, the capacity of the healthcare workers, we conducted training of these healthcare workers, because for you to be able to implement this protocol, at least you need to be trained. They have to know the protocols, what is required if a person is suspected of malaria fever. The person needs to go to the health center, and once it is confirmed, how are you going to do your investigation to find out the cases and then offer your treatment? So we provide support to NMCP to conduct training of these healthcare workers to be able to do case investigation. And of course, it is a real-time data. We also provide supports to help them with Blackview tablet, where they can do this case notification and investigation, so that if Auntie Oli or Usman sitting at NMCP Central Office will be able to have real-time information of the cases. At a glance, you can know, okay, this particular case is registered in Ilyasa or Farafenye, where the individual is coming from. Is it an imported case because of our proxy with Senegal also, whether the case is an indigenous case or is an imported case? All those things are followed up. And another component, we also try to strengthen in data quality. We started this effort with NMCP, trying to develop dashboards for them, where they can be able to monitor their performance in terms of malaria surveillance, where the cases are coming from visuals, and this work has been ongoing, and very soon we will have already we developed 3 dashboards for them through the support from PAT Senegal office and then Gambia. We also supported the development of the National Malaria Elimination Strategic Plan, because the old plan expired in 2025, so the new one, now we are moving to elimination instead of national malaria control to elimination. And that one was validated 2 weeks ago. Yeah, the National Malaria Elimination Strategic Plan is validated, which is going to guide us to be able to achieve a malaria-free Gambia by 2030. And on terms of data quality, we also provide support to them in terms of monitoring. The NMCP to conduct quarterly monitoring at these regions targeted for elimination, to see what is happening and what are some of the challenges that exist. And data quality issues, we also try to support in that. And also the modeling component, that is the subnational tailoring, using the local data to contextualize our interventions. As mentioned, the NMCP gives a lot of interventions. The bed net distribution that happens was one of it. The indoor residual spraying, the SMC campaign, that is the seasonal chemo preventive prophylaxis that is given to children. All these things are interventions that are used. We also try to see how best we can use our local data to say that based on the data that we have and the interventions, these are the communities that we need to prioritize. Not all the interventions should be implemented in one community. It should be driven by data. And by doing that one, you can be able to reduce at least 50% or 40% of the cases. So that is evidence-based. We're trying to do that one. And of course, support the GC8 grant application. And previously, they've also worked with NMCP to try the applicability of malaria vaccine in the country. So we offer all those.
You do a lot of critical work for NMCP.
Yeah.
But being, an American-funded, organization, and given Trump's approach to, aid and all of that, what's the future of PATH? I mean, in terms of financial sustainability.
Yeah, thank you, Uncle Peter. PATH is built on a solid foundation. It is a non-profitable organization, and it has been in existence for 40 years now. So it is not new, and not only American government support, areas like Bills and Melinda Gates also, and other philanthropists try to support, because the work that PATH is doing is broad, and for the specific project that we are running is the MASEPA, that is the malaria control and elimination partnership in Africa, and that work started since 2005.
Okay.
It was in 2023 we have the project in the Gambia, and even with that we were able to achieve a lot, and then the institution was able to survive the storm during the
we hope that it will survive, Trump completely. Coming back to you, Oli, you were going to...
I just want to add that, the USAID, funding has, ceased, but they have now replaced it with what they call US government funding. And this one, they are going to support the program mainly, with anti-malarial commodities, and stuff like that.
Again, it's good that you say that, because I see you all wearing, CRS branded jackets. Of course, he has PATH, and CRS we know is, an American.
So they are our long-term partners. CRS, we are like brothers and sisters.
Okay, long way to continue.
Yes.
I was going to ask Oli, since we are moving now from control to elimination, I hear, how has that changed the NMCP's strategy? Should the unit or department even be renamed, because it's not control anymore?
We have already renamed our program. Now it's National Malaria Elimination Program.
Is that
it's no longer it's no longer National Malaria Control Program, as already alluded by Usman and Saya. We are now moving from control to elimination. In fact, if you look at our data currently in the Gambia, if we are to use the WHO certification, because we have stratified the districts into stratas, and if we are to certify our country using the WHO guidance, we would be in the elimination phase by now. But we decided to use a different certification to suit our country, because for us we are using 1 to 10 as very low, which is 1 to 10 per thousand, and then we are using from 11 to 30 and above 30 as high burden. So, but if you look at WHO, their low is 100 per thousand. So we are not using that. So for the Gambia, we've done a lot. We have done a lot of achievement in bringing down malaria. If I can remember, in the 80s when I was working at the EF, it used to be RVTH.
No, it used to be only, in the 80s it was only RVH. Royal Victoria Hospital.
Yes.
It was Jammeh who brought the tea into it.
Exactly. So during that time, we used to have like 3-4 children in one bed with malaria. But now you hardly see malaria in under 5s. It's very rare to see malaria in under 5s. So. Yes, it's very, very low.
We always used to, when farmers were looking forward to the rainy season, others would say, it's the malaria season.
So this is why, as Sajja said, we have currently just validated our strategic plan, because that is our guiding in Bible when it comes to malaria control and prevention. That's what we use to guide the program as to the interventions that we are going to implement to lead us to elimination. And we also have our policy, and which is also reviewed and finalized. And these are the guiding principles for the program. And with these are also the tools that we use also to mobilize resources. We currently finalizing the costing of the strategic plan. That's what we are currently doing in the office, because we have to cost the strategic plan if we are to use it for resource mobilization.
Okay.
So we are currently also finalizing that. I think by this week, the costing should be final. And then that's what we use now to sell to our partners, both in country, at national and international partners.
Okay. So, when you finish formulating all that and getting it approved and, all the necessary funding secured, how will the strategy change? If until now it was control, either spraying the area, injecting, sick people with malaria and all of that.
So now
that was control.
Yes.
Now we are moving from control to a phase known as elimination. What will happen at elimination?
So in the elimination phase now, what we are doing currently is we are doing targeted interventions. because now we don't want to do business as usual. So what we do now, as I say, we already have certified the country, and we use that data to be able to target interventions to certain districts. This is why they were telling you that we are currently doing case-based surveillance in the North Banks, where we hope to soon eliminate malaria. So case-based surveillance will be very useful there. You don't need to do control interventions there. So you need to actually monitor everything that is happening. Like any case that is reported in any health facility, the notification comes. Even if I'm sitting at the office, I will receive the notification that a case has been seen in, for example, SO Health Center, and then if they have done any response towards that case, because this is why we go to the household to make sure that we give everybody in that household medication to stop transmission going on. Because anybody who has a malaria, it means there is somebody in the household that have transmitted that parasite to that person. So you don't want transmission to continue. So what you do now is you go to the household and make sure everybody is given medication, and you stop the transmission. That's the only way, because even the countries that have eliminated malaria, they did not eliminate the mosquitoes. What you try to do is to eliminate the parasite. So and this is what we are
this is what I was trying to get at, because for me, if I hear elimination, it's like,
you cannot eliminate the mosquitoes.
You can go to bed opening your windows wide open, don't worry about
you cannot eliminate the mosquitoes.
Whatever. So
what you need to do is to make sure that the mosquitoes that are flying or that are around don't have the parasites. So this is what we are doing currently in the North Banks, to make sure that we cut the transmission, making that everybody in North Bank don't have the parasite. So this is why we are also monitoring to see that the cases that are reported, are they indigenous? Because our goal is to have no malaria cases within indigenous. No indigenous should have malaria. So this is why we also look at the data to see, is this person, is it an imported or an indigenous case? Yes, because we want to also monitor that.
All right. 30 minutes is not a long time when you have three people sharing the 30 minutes. You know, we have only 5 minutes left between Saja and Usman. Let's start with Saja. Saja tends to go on and on and on and on. I'll time you 2.5 minutes, and then I'll give Usman the remaining 2.5 minutes.
All right.
I mean, we're moving from from control to elimination. How will technology help them in their work? Because you provide technical support, don't you? Data and all of that.
Yes, thank you. And innovation through science. Now there is malaria vaccination, and Gambia is eligible for that vaccination. So perhaps one of the things is to have the vaccination. And even in terms of the interventions, the last ITN campaign, the dual AIs net was used, which is an improved version compared to the previous cycles. And
improved
in terms of design and how it also knocked down the parasite, the malaria, the vector. And
we used to hear impregnated nets. Impregnated with what? Are these nets also impregnated?
Yes.
So if I may comment. So the nets that we used to have previously, they were treated with pyrethroids. These are the class of insecticide that have been used. But
I hope they were not. I hope that insecticide was not poisonous.
No.
Poisonous to the mosquito, but
not to the human being.
So along the line, there was this resistance that was building up. So the malaria control community, from research, they added something. They just, did this study, to understand the mechanism of resistance. And now they added something to the insecticide to...
Still harmless to the human, I hope.
Yes, counteract. That one may not be a kind of... It's not an insecticide, but it's a product that is added to counteract that resistance mechanism in the mosquito, so that when the mosquito lands on it, it cannot, that counteractive effect will not be there, and the mosquito will be susceptible to the insecticide. So it's kind of giving it a synergistic effect, so that the insecticide can work effectively.
Sajja, back to you.
That's fine. That's the dual AI, and also with the genetic.
Did you say dual AI?
Yeah, it's an active ingredient.
Okay, not
the artificial intelligence. Okay, and also the genetic modified mosquitoes are also like that can also counter the Plasmodium parasite, the Anopheles gambian. That is discovered in the Gambia, the malaria. Okay. So like all those things are technology, and also of course conducting like research in terms of the RDT, providing high quality that can be able to detect even if there is a statistical amount of parasite in the RDT will be able to pick the test. The sensitivities are high, and of course operational research where we are going to rely on evidence to say that okay, based on this we need to focus on this area. So all those things are going to enable us to be able to eliminate malaria by 2030. And of course, the political will needs to be there. Yeah. That the government are to really support him, but they also need to come on board because everywhere there is donor fatigue. So when that political will is there, the team, as it resonates, are driven to end malaria now. We can and we must. So that to end malaria starts with me, Uncle Peter, everybody in the studio. If we are not living on the insecticide-treated net, we started, and we also serve as an advocate to, to tell them that we are...
So you're recommending, sleeping on a bed net for every Gambian?
Yes. That is something. And every Gambian resources, advocacy, you can prevent. Like, we will run out of all forms of drug except Quatem. Okay. You will never go to a health facility and you are denied, not tested for malaria, or the malaria drug is not available. So all those things, once we do that one, if we reduce 5 cases, 6 cases, 7 cases, perhaps KMC will also turn green. So together we can achieve this thing.
I'll have to start learning how to sleep on a net again. Huh?
Yes, and also let me seize this opportunity to also thank my technical manager, Dr. Usman Jai, for being a very excellent leader, and also NMCP for hosting us at NMCP office, and anytime we call on them, they are ready, and then we stood side by side to fight malaria in the Gambia, and also calling on other partners, CRS, and other international organizations, let them also chip in so that we can have a malaria-free zone by 2030.
Fantastic. We'll extend the conversation tomorrow.
And I think we are also calling on all Gambians to join the push. Zero malaria start.
Do you have enough nets for every Gambian?
We have already distributed more than 1.5 million nets last year.
You still have nets? I don't have a net.
We have nets for under one, and for pregnant mothers now, because
neither of which I am. I'm not under one. I'm not a pregnant mother.
Your house was registered.
But I'm pretty sure during the distribution, your house must have had a bed net during the bed net distribution last year. Because we make sure that each household is rich and given a bed net. And those bed nets should last at least for 3 years.
Okay.
So
to
what
conclude, happens when after 3 years they come back to you and ask
we do distribute every 3 years. Okay. So just to conclude, I want to thank our partners. WHO, you have seen me putting on a vest with CRS.
We should chat for this.
Our international partners, Gambia Red Cross Society, the Minister of Health for the commitment to malaria elimination. We want to thank all our partners, including the community people, and we are calling on all Gambians to join the fight against malaria. Together we can eliminate malaria. And I also want to say that your radio should also continue the advocacy, because
we will work with Sajja.
The Gambia as
Sajja calls us every now and
Minister of Health cannot do it alone, so we have to partner with everybody.
Yes.
Malaria is everybody's business.
It is, yes.
So this is where all of us have to put our hands together to fight the disease and eliminate.
All right, we're coming back here tomorrow again. Yeah. We have another 30 minutes tomorrow from 8:30. We will give more information. Thanks to Oli, Sajja, Usman. Are you the three coming back tomorrow, or there's a new team coming?
We want to bring a new team.
You want to bring a new team tomorrow? Okay. Thanks for coming, and we look forward to the new team tomorrow with more information. World Malaria Day is on the 25th of this month. Every Gambian is advised to sleep under a bed net, because we want to move from the control phase against malaria to the elimination phase, where nobody is sick with malaria ever again in this country, unless, of course, you travel to a country that hasn't reached the elimination stage. You come back here, we will treat you, but then ensure that you don't transmit it locally, whether it's within the family or outside. Thanks for watching.
sant yàlla. looy xaar utal Wave nga scan nga fay te nag doo ci yokku dara.
If the world hasn't stopped moving, your money shouldn't slow you down. With Bloombank Africa, you are always connected, wherever, whenever, in many ways than one. So whether you're sending funds to family, paying for goods and services, settling bills, or just making sure you've got some cash at hand, Bloombank puts speed, simplicity, and security in the palm of your hand. Transfer funds between your Wave or AfriMoney account and your Bloombank account anytime, anywhere, because your money should flow at the pace of your life. Visit your nearest Bloombank branch today to link your account. Bloombank Africa. We make it happen.
Jar Oil Company stands tall as a trusted name in energy, keeping the Gambia moving with service stations across the country and a commitment to innovation and reliability. In Farafenni, Jar Group is reshaping our industrial landscape. The Jar Oil Cement Factory can produce up to 100,000 bags a day, reducing imports, creating jobs, and building a stronger Gambia brick by brick. And in the heart of the Central River region, Jar Farming Initiative is cultivating food security. With thousands of hectares under development and modern irrigation, Jar Farming is turning the Gambia's soil into abundance. Jar Group is more than a company. It is a vision of self-sufficiency, resilience, and progress. The Jar Group of companies, investing in industry, agriculture, and energy, building the Gambia's future today.